How are cancer terms translated across cultures? Cancer terminology translation across cultures is a complex process that goes beyond simply converting words. It involves understanding the cultural meanings, beliefs, and emotional responses tied to cancer-related terms. This is particularly important for reproductive cancers like testicular and cervical cancer, where cultural perceptions can greatly influence how people understand and communicate about these diseases. In many languages, especially in diverse regions such as Africa, there are often no direct equivalents for medical oncology terms. Some languages use borrowed or phonetic adaptations, while others may have translations that carry negative connotations. For instance, a survey of 40 for African languages revealed that translations for the word cancer varied significantly. Some terms were neutral, but many had associations with fear, tragedy, and incurability. Words like malignant and radiotherapy might evoke feelings of dread, which can lead to fatalism and stigma. This stigma can prevent individuals from seeking timely care or engaging fully with treatment options. Cultural beliefs also play a significant role in how cancer is perceived. In some cultures, cancer may be viewed through a spiritual lens, seen as a curse or punishment. This perspective can intensify the stigma surrounding reproductive cancers like cervical or testicular cancer. In certain African languages, the terminology for cancer may imply a malevolent force, which can lead patients to avoid the term altogether or use euphemisms to maintain hope. Communication practices can vary widely. In some cultural settings, healthcare providers may choose not to use the explicit term cancer to avoid causing emotional distress, especially among older patients. Instead, they might use terms like tumor or other indirect language. In Western medical contexts, however, full disclosure is often seen as essential for informed consent, which can create tension with cultural norms that prioritize protecting patients from harsh realities. To ensure effective communication in cancer care, it is crucial to go beyond literal translation and adapt terminology to fit cultural contexts. This means working with language experts and community representatives to create translations that are not only medically accurate but also culturally sensitive. For reproductive cancers, it is important to explain terms like testicular cancer or cervical cancer in ways that are both precise and culturally appropriate. This approach helps reduce fear and stigma while promoting awareness and treatment adherence. Culturally informed terminology can significantly improve patient engagement and outcomes, especially for reproductive cancers. For example, discussing cervical cancer in a way that acknowledges cultural beliefs about reproductive health can encourage more individuals to participate in screening. Similarly, addressing testicular cancer with language that demystifies the condition can help overcome barriers related to masculinity norms or embarrassment. In summary, translating cancer terms across cultures, particularly for reproductive cancers, requires a careful balance of accurate medical information and cultural sensitivity. This involves collaboration between healthcare providers, linguists, and cultural experts to develop communication strategies that enhance understanding, reduce stigma, and support patient-centered care.